name's Anita Sethna. I'm a facial plastic and reconstructive surgeon here at the Emory Aesthetic Center. And one of the surgeries that I do often is rhinoplasty, but it can be really confusing taking care of your rhinoplasty after surgery. So I wanted to create a little video to show people how to take care of their surgery. And the first thing that I want to say is that if I am not your operating surgeon, I want to make sure that you follow the instructions that are given to you by your surgeon. But for those of you who are having surgery or need a little help from an outside source, I'm happy to provide that. And the first thing that you're going to do is actually get a bottle of peroxide over the counter at your drugstore and some Q-tips. And the last thing is to get some over-the-counter antibiotic ointment. One of the things that we do at our recovery is give you some bacitracin, but over-the-counter polysporin or a generic triple antibiotic is perfectly fine. A lot of people will try to substitute Neosporin, and the only caveat to that is that about 5 to 10% of the population can develop a dermatitis or an allergic reaction to it. So my preference is to avoid that because it can look a lot like an infection. So if you can get a triple antibiotic, that would be better. The last thing that you're going to get is a can of nasal saline spray, and my preference is an aerosol can. It looks about the same size as the peroxide bottle, but it's got a little nozzle on the tip, and you're going to place the nozzle just inside the nostril, and you're going to give a little spray twice on each side every 2 hours while you're awake. It sounds like a lot, and most people can't do it that often, but if you can manage to do it several times a day, it's going to keep the inside of your nose a lot more moist, and it's going to help the recovery. Twice a day, morning and night, you're going to use the Q-tips and dip inside the bottle of peroxide. And you're going to twirl the Q-tip, just the white part of the Q-tip, on the inside of the nostril. Take a new Q-tip and do the opposite side, and then do the stitches right under the nostril. After that, you're going to take another new Q-tip and dip it in a little bit of ointment, twirl it around the inside of the nostrils and on the stitches. So you're going to do the peroxide and ointment in the morning and the evening, and you're going to do the saline several times throughout the day. The last thing that you're going to do is get some cold compresses, and you can do that any number of ways, but in our recovery, we'll actually give you a cold compress that has some crushed ice in it. And you're going to do that 20 minutes on, 20 minutes off throughout the day for the first few days after surgery. It limits the amount of bruising and swelling that you have, and it also will help with some of the bleeding because the ice will cause the blood vessels to constrict a little bit. And lastly, in order to limit the amount of bruising and swelling that you have, it's a really good idea to try to sleep on your back, but a little bit elevated. So I usually recommend about 30 degrees. That's a couple of pillows, if you can tolerate it. And the benefit of that not only is going to be to reduce the amount of blood that you might swallow, but also it's going to limit the amount of swelling and the amount of congestion that you have for the first few days. So I hope that answers all your questions and hope your recovery goes smoothly. Thanks.